Hello, this is Medical University on YouTube. Thanks for watching. Today's topic is diabetes, a condition that can go unnoticed due to subtle symptoms. However, diabetes sends out various save our souls signals that, if ignored, can be life-threatening. 1 in 6 people have diabetes. Many patients are diagnosed after the disease has progressed, leading to painful experiences like amputations, dialysis, or near blindness. Diabetes is scary because initial symptoms, if present, are often unnoticeable. By the time troublesome symptoms appear, the disease has frequently progressed too far. This video helps you identify if you have these symptoms now or in the future, enabling early detection. If you feel something is off with your body but ignore it because it's not too troublesome, this video aims to prevent a situation where it becomes too late to turn things around. I'd appreciate if you could listen until the end if you're watching this video. You may be someone who is health conscious, or you may be someone who is suffering from diabetes. There are various types of people on YouTube. Multiple medical professionals are posting videos that are easy to understand but contain conflicting information, leading to confusion among viewers. There are also those that simply list symptoms. And there are some that disseminate incorrect information. So this video will explain why these symptoms occur and in what order they occur. I will explain in an easy to understand manner, considering the body's structure. The video will be a bit long, but I hope it will help you think about your health and select information wisely to avoid being misled by incorrect information later. That's today's agenda. Surprisingly, you can notice diabetes by looking at your feet. You'll regret it if you don't know. Here are 3 warning signs of diabetes from the feet. Untreated, deep foot wounds called ulcers can form, leading to infection and gangrene, potentially resulting in foot amputation. I've seen such patients, and there are preventive medicines for foot wounds. I will also introduce how to apply the medicine. And then, in the second part, I will introduce 7 warning signs of diabetes. These symptoms could be the early signs of diabetes. And if you knew about them earlier, you could have gone to the hospital earlier and prevented them from getting worse. I will introduce these symptoms. And in the third part, I want to tell you something very important. Diabetes actually increases the risk of cancer. So if you have diabetes or have a family member with diabetes, I recommend getting screened for cancer. I will also introduce this. And then, Part 4 is a must-see, even for those without diabetes. Knowing the symptoms is important, but preventing diabetes is even more crucial. It's about taking preventive measures before pre-diabetes develops into diabetes. 3 types of people who should be careful as they are prone to diabetes. And in the 5th part, we will discuss how to prevent diabetes. I will introduce 2 carefully selected methods for early detection of diabetes. This will be a long video. Please take notes and listen repeatedly. Let me know in the comments if you found this study helpful while listening. And if you don't want to miss new videos, please subscribe to the channel. It would be encouraging. First of all, to notice diabetes, pay attention to your feet. I will introduce 3 unexpected symptoms that appear on the feet. The first of the 3 symptoms to watch out for on your feet is susceptibility to athlete's foot. Don't you think that athlete's foot is something that people with poor foot hygiene get? Actually, that's not the case. Surprisingly, it is said that people with diabetes are prone to athlete's foot. Athlete's foot is a fungal infection caused by trichophyton. When it infects the foot, it's called foot trichophyton. When it infects the nail, it's called nail trichophyton. Athlete's foot is more likely to develop in poor living conditions, and people with diabetes are especially prone to this fungal infection. The function of cells that fight off bacteria, such as white blood cells and macrophages, decreases due to the rise in blood sugar levels. Therefore, it is easy for infections to occur just by the bacteria attaching. But that's not all. Actually, when you have diabetes, your feet tend to become dry. I will explain the reason for this later. Wouldn't there be people whose feet become dry and cracked like this? This is because the barrier of the foot is broken, making it easy for bacteria to enter the foot and establish an infection. And there is also data like this. There is a research result that says 46% of people with diabetes have foot fungus and 53% have nail fungus. In other words, those who have these should be aware of whether they have diabetes. In addition to the reasons mentioned above, people with diabetes have weaker resistance to bacteria and their skin becomes dry and prone to injuries, making it easier for bacteria to attach. And then, what needs attention is this foot cracking is not just due to dryness but also due to athlete's foot. This foot cracking can occur occasionally. For those who say that foot moisturizing doesn't cure the cracking, it might be athlete's foot, so it's suspicious. Consult a dermatologist or your family doctor. Be careful. The second of the 3 symptoms of the foot is that the foot becomes easy to trip, like this. There is a report. Has anyone ever had a foot cramp? This could possibly be influenced by diabetes. We call foot cramps Charlie horse, but medically it is called painful muscle cramp. It is said that on average 4.5% of people with diabetes have foot cramps more than once a day, compared to almost none of those without diabetes. There is a report that says over a week about 2% of people without diabetes have foot cramps more than once, while 11.5% of those with diabetes do. Diabetes can make feet prone to cramps due to high blood sugar levels causing nutrient deficiency in cells. Understanding the reason behind this helps prevent misunderstanding and retain the information. Diabetes leads to elevated blood sugar, but cells may still lack necessary nutrients. We use a hormone called insulin to move the sugar in the blood into the cells and use it for energy within the cells. This includes muscle cells. Therefore, people with diabetes have poor insulin function or do not produce insulin, making it difficult for sugar and energy to move to the muscles, which may make them prone to cramps. In addition, the balance of minerals can easily be disrupted, causing foot cramps and so on. People with diabetes often develop a condition called neuropathy, which is a disorder of the autonomic nerves. Vasoconstriction and dilation are also controlled by the nerves, so this can cause poor blood flow to the muscles and lead to foot cramps. This is also considered a factor. I think it's easier to remember if you understand the reason. The last of the 3 symptoms of the foot that should be noted is that foot injuries are hard to heal. Why do wounds heal slowly when you have diabetes? Those who have listened so far may be able to guess the reason. First of all, when you have diabetes, your feet become dry and cracked. When they dry out, they become itchy, right? This makes your feet more prone to injuries. And people with diabetes have a decreased resistance to bacteria. This can lead to wounds festering, and as a result, they take longer to heal. And actually, that's not all. I will talk about diabetes later, but it is famous for causing something called neuropathy. It is said that this appears about 5 to 10 years after becoming diabetic. You may feel numbness or pain in your fingertips and toes, and eventually you may lose sensation and not feel pain at all. So, when you have diabetes and your neuropathy worsens, you may not notice the pain of a minor foot injury. By the time you notice, it may have worsened, and you may unknowingly cause blisters by burning yourself. This happens quite often, so when I examine people with diabetes, I always tell them to thoroughly check their feet, including the soles and between the toes, when they take a bath. This is to detect things like athlete's foot or injuries early, or to check if they are not drying properly. I explain this to them. Finally, in order to prevent your feet from getting worse, I will introduce you to the method of moisturizing. The important thing about moisturizing is what to apply, when to apply it, and how much to apply. Let's look at each one. What to apply is a moisturizer. Basically, there is no big problem. Over-the-counter moisturizers should suffice if you're not too troubled. If you see no improvement, get a prescription moisturizer from the hospital, such as Vaseline or heparin-like substances. Vaseline is a very common moisturizer. It has high moisturizing power, it's cheap, and it's an ointment, so it's easy to spread, which are its merits. And the thing called heparin-like substance is expected to promote blood circulation and heal wounds and dryness faster. On the other hand, a slight disadvantage is that it's a bit expensive. However, the advantage of heparin-like substances is that they can be prescribed in various forms such as lotion type, cream type, ointment type, spray type, etc. So you can moisturize according to your lifestyle. For those who don't know whether to choose a cream or an ointment, it's simple. The moisturizing power is high in the order of ointment, cream, lotion, but on the contrary, the stickiness is also strong in the order of Vaseline, cream, lotion. Therefore, if you don't mind the stickiness, ointment would be the best. And if you don't want to be too sticky, cream. And if you don't want to be sticky at all, if you want to emphasize ease of spreading, lotion would also be good. One point to note is that white cream types can cause a slight tingling pain when applied to wounds, so please be careful. I also have dry skin, but I apply ointment thoroughly before going to bed to moisturize. But during the day, I'm concerned about being too sticky, so I use creams and lotions as needed. Please try to refer to this. And next, when to apply is important. Actually, moisturizers can only moisturize, they can't add moisture. Applying ointment does not increase moisture, but it preserves the existing moisture. That's moisturizing. So the most important thing is the timing of applying the ointment. Please apply it after you get out of the bath. The skin after a bath is moist. By sealing the skin with a moisturizer at this timing, the moisture is preserved. I keep moisturizers in the bath and in the bathroom after I get out of the bath. Please remember the timing as well. And finally, the amount to apply. For example, there is a cream type ointment like this. This is the appropriate amount of ointment to apply to the entire foot. It's about the amount of one section of your finger. Please spread this amount of ointment over 1 foot. You might think it's quite a lot, but this amount is necessary to moisturize. If you feel that you are moisturizing but it's not getting better, there is a possibility that you are not applying enough. By the way, the amount to spread on both palms is about 1 section of your finger, so please refer to this when applying to areas other than your feet. This is a limited review. Symptoms of danger from diabetic feet that you will regret if you do not know. As the first of 3 choices, we introduce the increase in water bugs, then the second is the occurrence of foot ulcers, and the third is the difficulty in healing wounds. In the second period, we will introduce the 7 dangerous signs of diabetes that are dangerous if left untreated. First, we will explain the 3 symptoms that are likely to appear early due to high blood sugar. 3 symptoms due to high blood sugar. The first is dry skin. For those who thought dry skin was a skin symptom, what does this mean? Human skin has blood vessels running underneath it. If there is a lot of sugar in these blood vessels, it has the effect of pulling the moisture from the skin into the blood vessels due to osmotic pressure. Therefore, when blood sugar levels are high, the moisture from the skin is taken into the blood vessels, making the skin dry. And when the skin becomes dry, it can cause inflammation known as dry dermatitis, and some people may experience itching. The reason for the itching is not only this moisture, but also nerve damage caused by diabetes and uremia caused by kidney damage in diabetes, where toxins are not properly excreted in the urine. So people with diabetes may find that their skin becomes dry and itchy, so it's good to be aware of this. The second symptom caused by high blood sugar levels is a decrease in immunity. Actually, people with diabetes are more prone to fungal infections. I mentioned earlier that the skin can become itchy, and that's one of the reasons. But that's not the only reason. People with diabetes have a characteristic of being susceptible to fungal infections, such as athlete's foot and ringworm, due to their decreased immunity. Lately, I've been feeling unwell, and that could be a sign of the risk of diabetes. Not just athlete's foot. Not only athlete's foot, but also bacterial infections, skin infections like cellulitis that cause the skin to become red and swollen and hot, requiring antibiotics, and if left untreated, the underlying muscle and bone may necrotize. It can lead to a situation where the risk of diseases that may require surgery and even amputation of limbs is high. 3 symptoms caused by high blood sugar levels. The third symptom is a dry throat or frequent urination. This symptom is particularly likely to occur when blood sugar levels suddenly rise, so even those who are pre-diabetic and have a sudden rise in blood sugar levels may experience this as an early symptom. Many people may not have heard that diabetes can cause frequent urination. Indeed, in men, an enlarged prostate can cause frequent urination, and in women, overactive bladder can occur when the nerves become hypersensitive. These are the most common reasons. The reason why diabetes causes frequent urination is because the amount of urine produced increases. I'll explain the reason. It's similar to the reason why the skin becomes dry. As diabetes progresses, sugar leaks into the urine. Because sugar has the ability to attract water due to osmotic pressure, a lot of water is drawn into the urine produced in the body, which increases the amount of urine. Therefore, a lot of urine is produced. Urination frequency increases, causing dehydration due to excess water loss in urine. Sugar leaking into urine indicates high blood sugar levels, which increases blood vessel density. Symptoms like going to the toilet more often lately may appear. The human body, as a normal response, is trying to dilute the blood, so it's bad if you don't drink enough water. This makes you feel thirsty, and you tend to take in a lot of water. So if you've been feeling thirsty lately and drinking more fluids, that could be a sign. This could be a dangerous sign of diabetes, and what you need to be careful of is that the brain is issuing commands to take in water, but at that time a lot of sugar is included. If you gulp down sports drinks or juices, your blood sugar levels will rise dramatically and your brain will demand even more water and then take in water that contains sugar. This leads to a vicious cycle of further rising blood sugar levels, which can be life-threatening in the worst case. This is known as PET bottle syndrome, named after the clear plastic drink bottles. The above are 3 symptoms that are likely to occur relatively early when blood sugar levels rise rapidly. Next, I will explain the symptoms that appear after several years of having high blood sugar levels and becoming diabetic. The need for dialysis mentioned earlier, amputation of the leg or almost losing sight. These symptoms are also due to the effects of complications caused by the long duration of diabetes. I will explain 2 symptoms caused by prolonged high blood sugar levels. The first is eye symptoms. I usually diagnose diabetes or prescribe medication to people with diabetes and sometimes diagnose diabetes this way. Doctor, I've been having trouble seeing recently, and when I look at a white wall, I can see some black garbage floating around. Should I consult an ophthalmologist about this? I receive consultations like this. Actually, these symptoms may be caused by an eye disease caused by diabetes, and you may actually have diabetes. The entire body's blood vessels, especially the small ones, are the first to be damaged and symptoms appear. Why does it start from the small blood vessels? Because there are blood vessels here, and blood is running through them. What we call blood vessels are actually made up of individual cells called endothelial cells in the walls of the blood vessels. If there is a lot of sugar, glucose in the blood, it actually causes damage to the endothelial cells in the blood vessels by what is called active oxygen. To give you an image, it's like having a lot of gravel in the blood vessels, damaging the walls of the blood vessels. Because of this, symptoms are more likely to appear with a little damage to the small blood vessels, and since there are small blood vessels in the eyes, symptoms in the eyes are more likely to appear early. However, there are many people who do not show symptoms even if there is damage, so when I diagnose someone with diabetes, I always ask them to also see an ophthalmologist to check whether there is any eye damage. This is because if the discovery is delayed, the vision may become irreversible and they may not be able to do the housework or work they have been able to do until now. Vision is that important, and as I said earlier, it's like this. Can you see well or can't you see? When looking at a white wall, if you see something resembling moving garbage, it's called floaters because it looks like flying mosquitoes. This condition may also be a symptom of diabetes, so please be aware. Get an eye exam from an ophthalmologist. Prolonged high blood sugar can also cause neuropathy, which affects the small blood vessels in the nerves. The reason our bodies can move is because nerves are spread throughout our bodies, and the blood vessels that nourish these nerves are also spread throughout our bodies. Actually, the first symptom that appears due to prolonged high blood sugar is a symptom of the nerves. It is said that, as a rule, these symptoms appear 5 to 10 years after becoming diabetic. This includes numbness in the hands and feet, pain, and itching. Symptoms appear, and the distribution of these symptoms is characteristic, often referred to as glove and stocking distribution, meaning symptoms often start at the tips of the hands and feet, like where one would wear gloves or stockings. It is often the case that symptoms appear symmetrically on both sides. So diabetes doesn't usually cause numbness in the entire right side of the body. Numbness in the fingertips of both hands or toes is likely to appear as the smallest blood vessels run to the fingertips, making it easy to remember. Especially because the nerves are damaged, the sensation becomes dull. Numbness in your feet or unnoticed burns and injuries due to dull sensation can lead to untreated skin damage, which can easily result in bacterial infection, as mentioned at the beginning. The reason why people with diabetes are prone to water bugs or bacterial infections is related to this nerve damage. Therefore, if you or someone around you doesn't notice a shoe bite or has many foot injuries, it might be a sign of the risk of diabetes. It's hard to notice foot injuries unless you're aware of them, so please remember this. And finally, what is said to be the result of getting used to diabetes is due to the fact that insulin is no longer secreted at all. This is caused by symptoms or poor insulin function resulting from the pancreas being overworked and producing excessive insulin. I will introduce 2 dangerous symptoms. One is weight loss due to a decrease in insulin. You may think that diabetes is a disease that makes you gain weight, but that's not the case. Certainly, there are many people who develop diabetes due to diet, and many people think that diabetes equals weight gain. However, as diabetes progresses, your weight will continue to decrease. Why is that? First, let me explain the structure of diabetes. Insulin is a hormone that converts sugar into energy. If insulin is not produced at all, sugar cannot be converted into energy no matter how much you consume. Therefore, even if you eat, you cannot gain the necessary energy to live. The energy we take in through our mouths cannot be converted into energy, so we use our muscles and fat to somehow survive. As diabetes progresses, our muscles and fat waste away and our weight decreases. And then the second point. The symptoms caused by the overproduction of insulin due to the poor functioning of insulin caused by diabetes. That's cancer. The cause of diabetes is the poor functioning of insulin. Especially the organ that produces insulin is completely exhausted. The reason why obesity leads to diabetes is because the function of insulin deteriorates. The human body, when its function deteriorates, has to strain to produce insulin, and it secretes a lot of it. It is thought that this overproduction of insulin is linked to the risk of cancer. I mentioned earlier that weight loss can occur with diabetes, but when you have diabetes and develop cancer, the malignant tumor grows larger and larger, taking away the nutrition from the human body, so weight loss occurs due to cancer. And as the cancer grows, the body becomes ill. A feeling of fatigue appears, appetite itself decreases, and weight loss occurs. In any case, if your weight has decreased by more than 1 kilogram in a month without any effort, please consult a hospital. And when you develop cancer, your blood sugar levels rise sharply. That's pancreatic cancer. The pancreas is the organ that produces insulin. When a malignant tumor develops in the pancreas, insulin production and secretion issues lead to sharp increases in blood sugar levels. Even with a controlled diet, medication, and stable blood sugar, sudden spikes without lifestyle changes may indicate a problem. In such situations, doctors will check for any signs of malignancy, particularly pancreatic cancer. If you find that your blood sugar levels are rising sharply even though you haven't changed your diet or medication, please consult a doctor. What do you think? I explained diabetes, its symptoms and their causes. Please share your experiences in the comments, such as I had this experience. When I did this, my blood sugar dropped. Or I faced a serious situation. I would be happy if you could share such experiences in the comments section. Sharing everyone's knowledge and learning from each other would be wonderful. Thanks for watching the entire lengthy video. Information is overflowing. Because it's the age, knowledge becomes a weapon. Not only the symptoms and treatment of diseases, but why these symptoms occur, why this treatment is effective. I will explain it easily while showing the data. I made a mistake. Keep learning without breaks so you don't miss information. Review at the end. Diabetes is caused by factors such as diet and genetics, which make insulin less effective. Insulin converts sugar into energy, reducing sugar and lowering blood sugar levels due to high blood sugar. I introduced 3 symptoms. The skin becomes dry, the immune system is weakened, the throat becomes thirsty, the toilet becomes closer, and I also explained the complications caused by diabetes. Symptoms such as difficulty seeing, numbness at the ends of the limbs, and decreased sensation, and as a result of diabetes. When insulin levels drop, body weight decreases in reverse, and by producing too much insulin, the risk of cancer increases. I introduced such things. At the third limit, I'll explain the surprising link between cancer and diabetes that doctors want everyone to know. Do you know what is the leading cause of death for people with diabetes? Actually, the leading cause is malignant tumors. Why is that? I mentioned earlier that diabetes can cause complications such as eye infections or nerve damage, but actually, having diabetes is a risk for cancer, which is well known. I have diabetes, so I'm at risk for arteriosclerosis. So I've been taking measures against arteriosclerosis, paying attention to my blood pressure and cholesterol, but I haven't been taking care of cancer. There are patients who say they didn't get cancer screening because they didn't take care of cancer, and the discovery of cancer was delayed. I think it's absolutely necessary to know this. Diabetes increases the risk of certain cancers 1.97 times, 1.85 times, and colon cancer by 1.4 times. Overseas reports also indicate a higher risk of gynecological cancers, including uterine and breast cancer. It's surprising that diabetes can be a risk for cancer, and it's hard to imagine what the reasons might be. Understanding the reasons makes it easier to remember. In diabetes, insulin doesn't function properly. Insulin not working well, Because the blood sugar level is high, the body is strained and keeps producing insulin, leading to a state of hyperinsulinemia, where insulin levels remain high. It is thought that this may increase the risk of cancer. That's why people with diabetes should be careful and check that their cancer is not progressing. As I mentioned earlier, even if you don't change your diet, if your blood sugar level keeps rising, you should secrete insulin. I make sure to check if the pancreas, which is the organ that secretes insulin, is not developing cancer. Among the cancers I mentioned earlier that increase the risk, the ones included in the countermeasure type cancer screening are colon cancer, uterine cancer, and breast cancer screening. Let's learn about cancer screening in a simple way here. Cancer screening is divided into countermeasure type cancer screening and other types of cancer screening. The so-called countermeasure type cancer screening includes stomach cancer screening, colon cancer screening, lung cancer screening, breast cancer screening, and uterine cancer screening. These are the 5 types of cancer. These cancer screenings are subsidized by the government through municipalities. Therefore, it is recommended by the country to regularly undergo these cancer screenings. There is data showing that anyone who is eligible can definitely reduce their risk of cancer by taking it. From such things, it is recommended for everyone to regularly undergo colon cancer screening, which is a stool test. It is recommended for everyone to undergo such things as breast cancer screening and uterine cancer screening. I would especially like to recommend it to those with diabetes. Videos related to colon cancer and breast cancer have been released in the past, so please watch them from the description box after this. And even about pancreatic cancer, it is said to be a silent weapon. It is also common to have no initial symptoms. Famous symptoms include weight loss and back pain. As pancreatic cancer progresses, symptoms like decreased appetite emerge. Meanwhile, the risks of this cancer are becoming clearer. Diabetes is more common in those who drink alcohol or smoke. Another risk factor is intraductal papillary mucinous neoplasm. People with a type of cyst or fluid accumulation in the pancreas and those with a family history of pancreatic cancer are said to be at a higher risk. If you are one of these people or if you have any symptoms, it is recommended to check for pancreatic cancer with an echo. And if it is difficult to see with an echo, to undergo a magnetic resonance imaging or a CT scan using a contrast agent. To learn more about pancreatic cancer, check out the videos in the summary section. That concludes the 3rd period review. Diabetes increases the risk of vascular damage, but we emphasize that the most common cause of death is malignant tumors. Liver cancer, pancreatic cancer, colon cancer, breast cancer, uterine cancer. This indicates an increased risk of liver, pancreatic, colon, breast, and uterine cancers. Regular national cancer screenings and symptom awareness are crucial. If you are worried about your health, it is important to consult with your primary care physician. It's important to take care of your own health. If you want to consult about your health, you should. For those who want to discuss health, we have a regular YouTube live every Tuesday night at 9 o'clock. We can answer your questions, so please wait for us. It's important to know the symptoms of diabetes from the beginning, but it's also important to detect it early in the pre-disease stage or to not get diabetes at all. I will introduce 3 characteristics of people who are prone to diabetes. 3 characteristics of people who are prone to diabetes. The first one is having fatty liver. You might wonder what the relationship between fatty liver and diabetes is. Indeed, fatty liver is a liver problem and diabetes is a pancreas problem. However, this liver plays a role in storing our nutrients. Fatty liver is a condition where a lot of fat accumulates in this liver. It's like a foie gras state. It's a state where a lot of liver is already storing nutrients as fat. A normal liver is said to be able to store calories equivalent to 800 kilocalories. However, in the case of fatty liver, it has already stored fat, so it cannot fulfill such a role. Therefore, people with fatty liver cannot store excess energy in the liver, so it floats in the blood and blood sugar levels rise. If this fatty liver is left untreated, it can turn into liver cirrhosis, and in the worst case, it can turn into liver cancer. Once it turns into cirrhosis, it is generally said to be an irreversible condition, so you definitely want to improve this fatty liver condition. I explain about the lifestyle and dietary methods to improve fatty liver in this video. If you like, please watch it from the description box after this. Yes, characteristics of people who are prone to diabetes. The second choice is this medicine. Everyone, did you know that there are medicines that make it easier for you to become diabetic and raise your blood sugar levels? One of the representative ones is a steroid immunosuppressant. This is often used for autoimmune diseases such as Hashimoto's disease, where your own immunity mistakenly attacks your own tissues. It is also often used for other diseases such as asthma and atopic dermatitis. However, what you should be careful about is that oral steroids are generally the ones that raise blood sugar levels. Topical or inhaled steroids do not directly raise blood sugar levels. Please remember this. Continue using it cautiously, consulting your primary care doctor. Note that other medications can also raise blood sugar levels, such as antipsychotic drugs, which are often prescribed in psychiatry, or medications that affect the thyroid. This includes some diuretics. Medications are necessary when prescribed, but should be stopped immediately if they become unnecessary. Regardless of what, every medication has side effects, so it's best to take as little medication as possible. Absolutely. If you are taking the medication I just explained, please discuss with your primary care doctor whether you can reduce it. The third characteristic of people who are prone to diabetes is the order in which they eat their meals. Everyone. Do you know the term blood sugar spike? This is about the order in which you eat food. It is said that this order is related. If you eat a lot of good absorbers such as carbohydrates when you are hungry, your blood sugar level will skyrocket. When your blood sugar level rises sharply, you may feel sleepy or your concentration may decrease. Do you all feel this in your body? Our bodies. When blood sugar levels skyrocket, a lot of insulin is released to lower the blood sugar levels, and on the contrary, the blood sugar levels drop sharply. This rise and fall of blood sugar levels is called a blood sugar spike, and this can cause arteriosclerosis, damaging the blood vessels. It is thought to be a risk for future myocardial infarction and cerebral infarction, and the symptom of becoming hypoglycemic after eating is a symptom that appears in people with diabetes. Therefore, not raising your blood sugar too much with meals is actually considered important in preventing diabetes. What I recommend for such people is, it's called veggie first. The term veggie first has become frequently featured on TV. This is about eating vegetables first when eating meals. By eating from vegetables, dietary fiber is hardly absorbed, so vegetables enter your stomach first, and then things that are good for absorption come in. It is said that this makes the absorption of carbohydrates relatively gentle and reduces the increase in blood sugar levels. In fact, there is a study that targeted Japanese people where a group that ate from vegetables, chewed about 20 times per bite, and ate low GI foods had a lower increase in blood sugar levels compared to people who ate normal food. By the way, low GI foods are foods that do not easily raise blood sugar levels when eaten. White carbohydrates tend to have high GI values, making it easy for blood sugar levels to rise. Like white rice and udon, white bread. On the other hand, brown things, brownish carbohydrates have low GI values, such as brown rice, buckwheat, and whole grain bread. Such foods are said to be low GI foods, so they are also useful for reducing the risk of diabetes by eating from vegetables. Eat more vegetables and low GI foods to lower the risk of vascular diseases. I've summarized the key dietary methods in this video, which I'll post in the summary section. Now, let's review the forelimbs. The characteristics of people who are prone to diabetes are three selections. Those who have fatty liver cannot store energy in the liver, so blood sugar tends to rise in those who are taking medicine that raises blood sugar levels, and those who eat more staple foods than vegetables. I hope this is helpful for your reference. So in the end, it was like this. For those who think there is no way to detect diabetes before symptoms appear, I will introduce a method that can be detected early. The way to detect it early before becoming diabetic is to get diagnosed. Being diagnosed with diabetes can be shocking. The diagnosis is based on the hemoglobin A1C value, which indicates the average blood sugar level. However, you can't know if you have diabetes without getting tested. Therefore, getting a blood test is the recommended method for diagnosis. Before you get a blood test, if you do a certain thing and then get a blood test, you may be able to determine the risk of diabetes. What is that? It's eating 2 hours before getting a blood test. Many people think that they should not eat and be in a fasting state before getting a blood test. However, it is known that those with diabetes are in a state of postprandial hyperglycemia before being diagnosed with diabetes. Diabetes is a condition where blood sugar levels are often high, but the stage before becoming diabetic is usually normal blood sugar levels. But after eating, postprandial blood sugar levels are high. There are such signs. Therefore, in order to catch that, we look at the blood sugar level in the blood test 2 hours after eating. By doing so, I might not be a potential diabetic. There may be cases where this leads to early detection. In fact, postprandial blood sugar levels are part of the diagnostic criteria for diabetes. In hospitals that are trying to aggressively detect and treat diabetes, it is common to perform tests that measure this postprandial blood sugar level. This is called a 75-gram oral glucose tolerance test. This test measures blood sugar levels before eating 2.64 ounces of sugar, immediately after eating, 30 minutes after eating, 1 hour after eating, and 2 hours after eating to see if it is like diabetes. This is a test that is used too. I suggested trying to finish eating 2 hours before the blood draw, so in more detail. For those who want to know more, I recommend this test called the 75-gram oral glucose tolerance test. If you can catch and counteract at this stage of postprandial hyperglycemia, you can avoid becoming diabetic or suffering from diabetes related. As mentioned earlier, there were many dangerous symptoms. Such symptoms may not appear, and the diagnosis does not become ridiculous. The average blood glucose level, called hemoglobin A1C, also, if you take the diagnosis every year, the criteria for diagnosing diabetes are not high, but you can notice that it is increasing every year. From such things, you may be able to notice the risk before becoming diabetic by taking a thorough health diagnosis, taking measures as I mentioned earlier, and taking blood. I would be happy if it could be a reference like this. At YouTube Medical University, we share knowledge for healthy living from a doctor's perspective. If you find the video helpful, pressing the like button is encouraging. More, and please subscribe to my channel to stay updated with new video releases. In this information-saturated era, you can trust my content. Connecting with a reliable channel is crucial. Though the video was lengthy, I appreciate you watching it fully. Unexpected things, particularly questions, became a valuable study. Please comment below. See you in the next video. How to live without getting old from the 70s that I, a general practitioner, learned from patients is a bestseller in 4 Amazon departments and the gift ranking. It became #1. In the course of my usual work as a doctor, I compiled into one book the important ways of life and health methods that I learned from my patients. I also want to live healthily in this way, and it has become a book that makes me think so. It's selling well, so please check it out.